The distal radius is the most commonly fractured bone in the upper extremity. Located at the wrist end of the forearm, it plays a critical role in load transmission and wrist mobility. Distal radius fractures typically result from high-impact forces to the wrist, often caused by falls or trauma. The 2.4 mm variable angle distal radius plates are designed for fixation of complex intra-articular and extra-articular fractures, as well as osteotomies of the distal radius. They are also suitable for fractures involving the epiphysis or metaphysis, and for physial crush injuries. Implant options. The system offers 3 plate options to accommodate different anatomical and clinical needs. Standard provides an optimal balance of fixation points and plate width, suitable for a wide range of fracture patterns. Narrow, designed for smaller wrists or cases requiring more minimal fixation. Wide, ideal for larger wrists or situations demanding higher fixation strength. These plates are intended for volar distal radius application within the 2.4 mm system. An elongated locking combi hole allows for precise plate positioning and fine adjustment of radial length. The combi holes support both fixed-angle locking screw fixation with angular stability in the threaded portion, and compression using cortical screws in the non-threaded portion, offering flexibility during fracture management. Reduce the fracture using a method appropriate for the fracture type, and temporarily stabilize it with K-wires. Select the appropriate plate according to the fracture and patient anatomy. Use a K-wire to provisionally position the plate on the fracture site. Drill through the elongated hole in the plate shaft using a 1.8 mm drill bit with the double drill guide 1.8 mm 2.4 mm. Insert the depth gauge into the drilled hole to measure the required screw length. Insert a 2.4 mm cortical screw using the screwdriver and screw holding sleeve. Adjust the plate position if necessary, then fully tighten the screw. Place the cone-shaped end of the universal AV Wiselock drill guide into the AV Wiselock hole of the plate. Using a 1.8 mm drill bit, drill through the guide at the desired angle to create the hole at a variable angle. Use the depth gauge to measure the required length for the 2.4 mm AV Wiselock screw. Attach the quick coupling handle to the 0.8 Nm torque screwdriver connected to the screwdriver shaft. Using the assembly, screw in the variable angle screws. Alternatively, select the appropriate size of aiming block corresponding to the selected plate. Align the aiming block with the head holes of the plate. Secure the aiming block onto the plate using the aiming block screw. Drill the bone through the guide sleeve using a 1.8 mm drill bit. Measure the screw length directly from the markings on the sleeve. Insert a 2.4 mm AV Wiselock screw using the screwdriver assembly. Repeat this procedure for the remaining AV Wiselock head holes with 2.4 mm AV Wiselock screws. Once fixation is complete, unscrew and remove the aiming block from the plate. Drill the distal holes in the plate shaft with a 1.8 mm drill bit using the double drill guide 1.8/2.4. Use the depth gauge to determine the required screw lengths. Insert the 2.4 mm Wiselock screws with the screwdriver assembly. Add more 2.4 mm Wiselock screws for additional fixation. Finally, remove the K-wires from the bone to complete the fixation. Following fixation, early controlled motion and proper rehabilitation help restore wrist function while protecting the repair. Patients receive clear guidance on activity, wound care, and gradual return to movement. With precise fixation, stable construct design, and next-level care, patients can confidently move toward full recovery and restored wrist function.